Hey, good afternoon, everyone. Today is May the 18th, of course, 2020. It's a Monday, and I want to thank you all for watching our community briefing and, of course, our media briefing, which will answer any questions from the media. At the end of the briefing, we'll also have, después de las preguntas, tenemos un recapo en español, so we'll have a recap in Spanish from Alice from the Health Department, and, of course, Paola is doing our ASL translation. And then we have Dr. Davis, of course, from the Health Department, who is also here to give an update and to answer any questions. And so thank you for joining us. And I'm going to talk today about some numbers, how we did a little bit over the weekend. I'm going to talk about the governor's announcements today as it relate to reopening the economy. And then I'm going to also mention some new programs the city is launching as it relates to restaurants and open streets, and some senior meal delivery programs, and of course answer any questions. So let's first talk about the overall numbers and the rate. We know that we have 1,305 residents who have in total tested positive for COVID-19. 848 of them have recovered, so that both those numbers continue to go up, as we know, because we're doing more testing, there will be more positive cases, and of course, more people are recovering as well. And so those numbers continue to go up, and they should be expected to. There's been some questions about the batches of tests coming in, because there's been some unevenness as far as one day might be very few tests, another day there might be a lot of cases. And the city is still trying to work out some of the backlogs with the lab structure that's in place on the back end. We're not the only ones having this issue. LA County and other jurisdictions are as well, and so we're trying to get all that information. And as you look at the data of cases, we are, of course, making those adjustments. And so the data logs that you see and the data on the dashboard generally is correct. And as we move forward, as you look kind of backwards, we're filling in any issues that might arise, and so that continues to change. Also, we do know that we've had one additional fatality and death. We're at a total of 52 deaths, of which 41 have been in our long-term care facilities. And we know that's been a real kind of special point that we're really watching and that we're taking a look at, and we continue to do so. But that's where we are as it relates to the numbers. And so hospitalizations are at 63 folks as of today in the hospital. The number was a tiny bit higher, I think, yesterday, the day before, and lower before that, and so that number has fluctuated some, and we watch that very carefully. This Friday will be 2 weeks exactly, 14 days since the relaxing of the safer at home orders, where we began opening up the recreation and the retail, and so we're going to get a really good picture towards the end of this week, or at least a more clear picture towards the end of this week, how we've been doing and what the impact of these reopenings has had on the city. And so I'm optimistic. We're all hopeful that we're going to have a good report, but of course we'll wait and see. Let me turn over to some announcements and what happened this weekend. So just want to first say that overall, this weekend went well. We felt that at least the police department, the code enforcement teams, the health teams, the firefighters, there was obviously vast majority of people were complying over the weekend. Folks were being safe, they were distancing. It's not the case for everyone. We know there were additional challenges in the Bixby Park area, along the bluff, but the beach generally operated safely. The lifeguards did a good job of kind of moving folks along that were gathering. There were multiple folks that were asked to move along in our parks or in our bluffs. And so generally good. A lot of folks were complying and wearing face coverings, which, by the way, keeps you safer and keeps others safe. But a lot of folks were not. And as a reminder, face coverings, we're asking folks, and we're required to wear face coverings when we are outside and in contact with other people. There are other people around us. We should be wearing a face covering. If you're alone and walking through your neighborhood by yourself and there's no one around you, like the health order says, that would be an okay opportunity to not have to wear one. But if you're going to be in the presence of other folks around you, and certainly in a place with a lot of activity happening, and certainly if you're going into a restaurant to pick up to-go food or you're going into a retailer to pick up curbside pickup, all of those require face coverings. And so I get that it's impossible to make everyone follow the rules, but to those that are following the rules, just know you are keeping yourself safe and you are keeping others safe as well. And so thank you for caring about the most vulnerable in our community, and we appreciate that. Let me just say also, the governor made some announcements today as it relates to speeding up the economy. He talked some about personal grooming, and so I want to address those a little bit. Let me just first say that the governor made a couple key announcements today. The first was that he did announce that more counties would get a chance to speed up through the stages. Remember, we are in stage 2 right now, and we have reopened everything that the state health order allows us to reopen as it relates to retail and restaurants. He announced that vast majority of California's counties can apply to move faster. But as a reminder, not all counties or health jurisdictions meet those qualifications. And Long Beach does not meet those qualifications, and the County of Los Angeles does not meet those qualifications. We don't meet them as a health jurisdiction on our own, and we don't meet them either as it relates to being the whole county. So either way you look at the data, we cannot move faster than that state health order baseline because of the amount of cases and hospitalization rates that we have. Now, we're doing better as a city than the county as a whole, and we're doing better than some urban centers, but we are not able to speed up any of that. And so for the questions that we're getting, well, the governor announced that we can move quicker. He did, and he adjusted, by the way, the requirements to move faster. He loosened those up, but he loosened them up greatly, but we still, even with that loosening, don't meet those requirements. So I think it's important to be honest and straightforward with where we're at, and we're not there, so we won't be able to move forward any faster. And again, we don't even know the data within our own health jurisdiction to know yet if that's even possible, because we still have this week to go and look at some of that data. So that's number one. So we don't meet the criteria. And so we continue to open slowly and in a way that's done to ensure the maximum safety of our community. The second thing the governor mentioned today was about personal grooming and barbershops, which we all know a lot of people want, which we understand. And we also understand that that it's a huge need for barbers and for personal grooming for those that are in salons that are suffering and whose businesses are hurting. He talked about maybe we're weeks away from those activities in his message today. And I want all those that are involved within that industry to know that we're also actively discussing here in Long Beach how those activities could be done safely. We'll be hosting later this week, I think Thursday, and there'll be messages out within the business community, some conference calls and some discussions with anyone that is either a stylist, an owner of a salon, of a barbershop, a nail salon, personal grooming. You'll be hearing from the city, from your business group, about some meetings and conference calls we'll be having this Thursday to start talking about how we can begin having these really critical activities open up in a way that's safe when we're ready to do so. So that work is continuing. Also want to mention that tomorrow night, the City Council will be debating and discussing our Open Streets Initiative. Our Open Streets Initiative is something that we have been talking about to reopen some of our public streets and sidewalks and parking lots. One, so that the public can enjoy them and walk around in a way that's socially distanced, but also in a way to help our small businesses, especially our restaurants. So we're talking about allowing restaurants to reopen in our public right-of-ways, moving into some streets, closing down some streets, allowing greater outdoor dining so that these restaurants can survive, because we know that when we reopen, limiting their capacity or just allowing the outdoor dining piece is going to be very hard to physically distance. And so we want to create a network of open streets, parking lots, sidewalks, where we can expand outdoor dining. And we're planning on that right now. We do know that this activity is not yet allowed under the state health order and the cities, but we are getting ready so that we can do it safely. And there's a lot of work happening. The council's discussing this tomorrow. And so I want to thank all the restaurants that are involved in this work and are involved in this planning, as well as our Restart Long Beach Committee, who's working on this question, the advisory group, and the City Council. And in talking about restaurants and food, I want to also, we announced today a great new program for restaurants. In partnership with Governor Newsom, who is launching this program statewide, we're announcing our Great Plates program to kick off here in Long Beach. What the Great Plates program is a new program that will allow restaurants to make meals for seniors and for older adults, 3 meals a day, and then we'll deliver those meals from the restaurant to the location where the senior is across the city. Now, we already have the World Central Kitchen program, which is providing thousands and thousands of meals across the city. And so we know that we've targeted senior buildings. So we have senior buildings across the city that are being covered by World Central Kitchen, which we're very appreciative of. But this program will help fill in the gaps and expand our senior meals program even broader. And it also helps the restaurant economy. And so for those restaurants that are also struggling and workers, it will allow restaurants to provide more consistent meals to more seniors across the city. Beginning today, there's a period where restaurants can apply to be a part of this program. It is a competitive program. You have to meet qualifications. And that goes through this Thursday. We want all the restaurants that are interested to sign up, and then the city will go through its process. If you have questions, you can email greatplateslb@longbeach.gov. It's greatplateslb@longbeach.gov if you're a restaurant with questions. We've also emailed the information out to restaurants, and we're looking for restaurants that are locally owned or locally sourced, prioritize local jobs and worker retention, and are providing meals that meet nutritional standards and that are offering safe production guidelines within their own restaurant. So these restaurants will be considered first, and we're excited again to help more restaurants in this way. And so that's something that we are looking forward to as well. Let me also just say that there's a lot happening as it relates to the budget. There'll be a huge budget presentation to the city tomorrow as well, so we'll have more information on that on Wednesday. And I'm going to turn this over to Dr. Davis. I know we have a lot of press questions, so we'll get to those, but she also has an update. And so let me go to Dr. Davis.
Thank you, Mayor. Good afternoon. First, I'm going to talk about underlying health conditions. Businesses and outdoor areas are starting to reopen, and we're using the knowledge and resources we've learned to do so as safely as possible, because the risk of COVID-19 infection and transmission is still there. So it's really important for those at higher risk of serious illness to take actions to reduce their chances of infection. So those at higher risk of severe illness from COVID-19 include people who are older than 65 and people of any age who have serious underlying medical conditions, including asthma, chronic kidney disease, including being treated with dialysis, chronic lung disease, like emphysema and chronic bronchitis, diabetes, hemoglobin or blood disorders, immunocompromising conditions such as cancer treatment or having had an organ transplant, liver disease, serious heart conditions like congestive heart failure or having had a heart attack, and severe obesity, among others. If you're at higher risk for serious illness from COVID-19, it's extra important that you take the actions to reduce your risk of getting sick or getting infected. So you should be extra careful with the precautions that we recommend for everyone, including really following the Safer at Home order closely, also avoiding all cruise travel or non-essential air travel, washing your hands often and well, practicing social distancing, physical distancing, avoiding crowded public areas and staying 6 feet away from anyone you don't live with, keeping away from people who are sick, and cleaning and disinfecting frequently touched surfaces in your home. In addition, if you have an underlying health condition, you should manage your condition as best you're able. Remember to take your medications, like they're prescribed, and don't change your treatment plan without talking to your doctor first. Stock up on supplies, including at least a 2-week supply of prescription and non-prescription medications. Talk to your healthcare provider about getting a 90-day supply of mail-order prescriptions, if possible, to reduce unnecessary trips to the pharmacy. Talk to your healthcare provider about whether your vaccinations are up to date. People older than 65 and those with many underlying health conditions are recommended to receive vaccinations, including influenza and pneumococcal disease. Don't delay getting emergency care for your underlying condition. Emergency departments have plans in place to protect you from getting COVID-19 if you need urgent or emergent health care because of your underlying conditions. Call your healthcare provider if you have any concerns about your underlying medical conditions or if you get sick and think that you may have COVID-19. If you need emergency help, call 911. So now I'm going to turn to the weather change and how that may or may not affect COVID-19. There's been a lot of debate whether the risk of COVID-19 transmission will decrease as the weather warms up or as summer comes. However, at this time, there's not enough evidence to say whether this is true or not. It's not known whether weather and temperature will affect the spread of COVID-19. Some other viruses, like those that cause the common cold and the flu, spread more during cold weather months, but that doesn't mean that it's impossible to become sick with either the common cold or the flu or other viruses during summer months. There's much more to learn about the transmission, severity, and other features associated with COVID-19, and investigations are ongoing. There's many different factors relative to the seasons and the spread of a virus. Those include humidity and temperature, how long the day is, and viral sensitivity to UV light, how much time we spend outside and in more or less proximity to others, how sun exposure, melatonin, and vitamin D may affect things and the virus in our immune system, and the level of immunity in a population. So we just don't know yet how all of these factors will affect whether COVID-19 risk will decrease or not as summer comes. So I'd recommend preparing for COVID-19 to be present throughout the summer and into the fall, and continue to follow public health recommendations of hand hygiene, physical distancing, wearing face coverings, and staying home when sick and away from others who are sick for the next months ahead. Thank you.
Thank you. And thank you, Dr. Davis. We'll go ahead and answer questions, and then we'll do our Spanish recap.
Great. Thank you very much, Mr. Mayor. The first question is from Rachel Jordan from ABC 7. Go ahead, Rachel.
Hey, so this question is for Dr. Davis. ABC 7 wants to know more about recovery data. So how does the city keep track of recovered patients and patients who are recovering, and what are those numbers based on?
The numbers are based on, it's an approximation. So the numbers are based on the fact that it takes approximately 10 days to recover. And so as people are moving through the disease spectrum, as we get further away from when the onset of their symptoms, then we place those folks into the recovered kind of category. I think as we go forward and there's more contact tracing that's done, that may shed more exact light on the number of recovereds. But right now, it's more of an approximation.
All right. Thank you very much, Dr. Davis. The next question is Kelly from the Long Beach Post. Go ahead, Kelly.
Yes, hi. The state today said it's focusing on infection rates as a top indicator for counties reopening. And I've noticed that unlike the county and state, Long Beach, I don't believe, has put out the number of infection rates. That's the number of people testing positive compared to the number of people being tested overall. Question, why hasn't the city put out infection rates yet? Is that a number that we have? Or is there some maybe issues with the backlog of why we don't have those numbers yet? And is the city focusing on or moving towards using that as an indicator of whether we can reopen, in addition to hospitalization rates?
So I think we'll be looking at a number of indicators, and infection rates or positivity rate will definitely be one of those that we will be looking at, as well as hospitalization rates, ICU use, testing, how many are testing volume, being able to contact people within a certain amount of time. So there'll be many kind of metrics or indicators that we will be working on to follow. Right now, we have looked at those things, and like the mayor mentioned, a lot of those indicators are being looked at in order to accelerate through stage 2 or to have more flexibility in stage 2. And we've looked at those rates and we know that we don't meet that. And so as we kind of progress through stage 2 with the state, we'll be looking at more of these indicators just to tell us where we are relative to other jurisdictions and other areas.
And it also may because I think that's a good question as far as the data. So I imagine that, and I believe we've discussed it. I mean, we have that data. So I don't know. It's not. I think that data is looked at by the health department, and so as far as adding that as on the public dashboard or putting that out, I don't think that would be a problem because that data is collected. Because I know that we've asked kind of that question before, and it's been. I know that our health department director has in conversations mentioned that data to me. So. I'm sure, Kelly, we can get that and possibly maybe put it up in a more public-facing way. So we'll pass it along, and I know Jake's here, and so we'll take a look at that.
Thank you very much, Mr. Mayor. The next question is from Jeremiah from the Long Beach Post. Go ahead, Jeremiah.
Hi, guys. Thanks again for taking our questions. I wanted to ask about a number of people in hospitals where the county and the state have both said they've had a modest decline in the number of people hospitalized over the past couple weeks. And the data on the dashboard shows Long Beach is actually the opposite. We had like an average of 61 people per day in the hospital last week. The week before that, it was about 55 a day. The week before that, it was about 51 per day. Why are our hospitalizations headed in the opposite direction as the state and county? And how concerning is that? And at what point does that force you guys to make changes in what's going to be reopened and whether we need to pull back on reopening?
Can you both answer that? You want to go first? I'm going to go first.
Sure. So yes, it is concerning. Anytime somebody is hospitalized is definitely a concerning factor in COVID. It means that they have more serious disease. I think part of what's going on for Long Beach is our residents in long-term care facilities who are more at risk of having severe illness and being hospitalized. It is something that we are following closely, and I think it is, one marker of why we need to be really careful about our rate of reopening and making sure that we really encourage and educate everyone to follow the safer at home orders and to make sure that they're physically distancing and to make sure that they're not going to work when ill, because that's one of the main ways where transmission can happen.
Yeah, I'm going to agree. And I'm going to also support, I think Dr. Davis and the health department did a great job of reminding us that we still have a lot of information to collect to know how we're doing. I think it's too early to be able to say that we've had certain level of success with the reopenings or how safe it's been. We just need more data and information. And I think the hospitalization rate is a critical data point when you look at how you reopen. It's not the only data point, of course. I think there's a lot of other things you're looking at. You're looking at some PPE supply, you're looking at amount of beds available, you're looking at ventilator availability, looking at cases and positive cases, and you're looking at deaths, of course. And so in all of those, I mean, Long Beach is doing kind of different depending on which one you're looking at. And certainly when it comes to deaths, I think the city seems to be doing a little bit better than the county, even though each of those is serious. And I haven't looked at the county's hospitalization rate recently, so I'll take Jeremiah, so obviously your word for it. But I think we should be in Long Beach looking at that, and if that number continues to go up, that we should be concerned about that. And that's why we have to just be very, very thoughtful and really look. I personally am kind of anxious to see where we're going to be at the end of the week and where the numbers are going to be at. And that's what I'm going to be looking at, because I think that we really need at least, at a minimum, those 2 weeks of gathering information and probably more than that. And so I think that that's a fair critique that we should all be making ourselves, is what that rate looks like and what the other indicators say as well.
Thank you very much, Mr. Mayor. One more question from Jeremiah from Long Beach Post, and then we're going to go to Facebook for some of our questions on our live feed. Jeremiah, go ahead.
Hi, guys. Thanks again. Shifting gears a little bit on this one, talking about enforcement. You talked about over the weekend, most people complying. But there was a specific gym called Iconics that actually intentionally violated the health orders by hosting an outdoor yoga class as kind of an experiment, and then wanting to prove they could do this safely. And I wanted to get the city's reaction to that. Is what they did safe? If it wasn't, why not? And what, if any, enforcement action will be taken in a case like that where this business is intentionally violating the order?
I mean, we can both comment. I mean, well, first, it was clearly a violation of the health order. The city is taking appropriate action, just like it would with any business that violated the health order. And so, Iconics is a well-known gym. It's actually a great facility for those that have been there. So it was disappointing to see what happened there. But I do know that the city has taken there is a process. I think that is fair, and that the city has for any business that would go through or violate the health order. And that process is it's prescribed in the order, I believe, Dr. Davis. Mm-hmm. And so there's a step-by-step process in that. And from what I understand, that kind of first step has taken place. But I don't know if you have any additional comments on that.
No, I think just in general, as more businesses, so I can't comment about how Iconics ran their class. I'm just not familiar about what they did. But I think in general, the more people that are out and about, the more risk there is. So not specifically to that one class, but just in general, the more that people are able to move around, the more chances that there are for someone to be within 6 feet of someone else for some prolonged period of time. They may be infected and not know it, and so therefore the risk of transmission goes up.
All right, great. Thank you very much, Dr. Davis. All right, now as we move forward into this, as relates to questions from Facebook Live, we'll go ahead and start with a couple of questions. Mr. Mayor, one of the big questions that we have, obviously, that we continue to address in these conversations is questions with regard to parity between small businesses and large retail stores. And the question is really along the lines of why can't they open if they still enforce and incorporate the physical distancing guidance? They still want to open, and people are concerned about that. And obviously, I think a lot of the comments are here is the small businesses are really struggling right now.
Well, we're all concerned about that. The truth is that they're not allowed to open under the state health order. And so, we know that that we have opened in Long Beach everything that is that we can legally open as it relates to retail. That is allowed in the state order, and our local order aligns with kind of that state direction. So those decisions about which retailers would be allowed to open first was made a long time ago, obviously through a state process, and it was tied mostly to access to foods and to what they viewed as essential types of items. And so that is where we're at today. Whether we like it or not, that's where we are. And so we have to do the best we can to provide and assist these smaller retailers. I know that they are really suffering, and a lot of workers are as well. And so that's why we're preparing. So when these smaller retailers are allowed to open under the state order, then the city can move in and provide and put in our own guidance and orders to ensure they open safely. And so that's where we're at. But again, that is not a city decision why they can't reopen. There is a statewide baseline. No smaller retailer is allowed to open currently statewide, and those that are on the expedited track, areas like Long Beach that are more dense, they're not on that expedited track because of the data that we have and our health indicators.
Thank you, Mr. Mayor. You know, it's an interesting question here, and it talks about what laws are breaking if we open retail for in-store shopping. And I really want to stress to the viewers out there that effective on May 12th, 2020, the City Council did pass an emergency ordinance, and this was part of the municipal code based on that. And if for those that are wanting to get that information relative to that, it's 120.010 alpha. And that temporarily allows for civil, administrative, and/or criminal enforcement to the health order. So those that are asking questions about what gives you the right to enforce this, that's exactly what happened effective May 12th. So I want to make sure we share that with everyone. Moving forward into that, another question is, Mr. Mayor, talk a little bit about the rent moratorium, and obviously that's coming up on Tuesday. Can you give a little bit more guidance and discussion on that?
There is a discussion tomorrow night. The council will decide about extending the rental eviction moratorium. And so that is up tomorrow, and so we'll see where the council goes. The proposal in front of the council right now is to extend that moratorium. And as far as what the extension will look like, that's all up for discussion and debate. And so I encourage, if you're interested in that, to please contact your council member, because they'll be voting on that tomorrow night. And so that is a big discussion. But we're very aware, I personally am very aware, that you have folks out there that are struggling, that can't pay their rent, and that are living day to day with their families. And so that it's a serious issue. And we also know, and I'm hearing from a lot of folks, kind of small and pop owners that might own 1 unit or 2 units in the city, and they're also having a hard time with their banks because they're not able to pay their mortgage on their rental properties. So this is an issue that affects the tenant, and it also affects particularly small mom and pop property owners. Let me just say that the city is working right now on a program to directly assist renters by providing a direct kind of rental assistance allocation. This has already been discussed. I mean, the council has brought this up. The county of Los Angeles has a program that's similar, but we expect that by the end of this week, the city will be announcing a program to directly assist renters, particularly those that are low income and that are having financial hardships, with paying their rent. And that rent would then go to help pay their rent, which quite frankly not just helps the renter, but is also helping make sure some of these small mom and pop property owners get assistance from their banks. So some of these banks are, quite frankly, are being completely unreasonable in providing mortgage relief for some of them. And so to the tenants that are out there and the renters, we'll have more information at the end of the week, hopefully with some assistance, because we know this is a program that's happening in other places, and Long Beach should be participating as well. And so our staff has been working for weeks on this program, and it's going to be ready to be rolled out real soon.
Mr. Mayor, the last question I have for you, and then we'll switch over to Dr. Davis, is relative to the refunding city business license fees. And I know there's been some conversation about that. Has there been any discussion that you're aware of relative to that?
There has. I think the city's looking at that, and so that's something that I believe at some point soon in the next couple of weeks, there'll be some recommendations from the staff on that issue.
Thank you. Dr. Davis, moving over to our preparation within the city here, are hospitals and clinics prepared with personal protective equipment and ventilators should we see a spike in cases?
Yes, so thank you for that question. We are prepared. Our hospitals have ample bed capacity, ICU capacity, ventilators, and PPE. So that is something that we've been tracking very carefully, and we'll continue to track and to work with them to make sure that they have what they need. But right now, they're set.
One of the other questions that we're seeing here is relative to the masks. And this is obviously something that is out there, widespread, about masks being appropriate, working or not working. Can you get, from your perspective as a physician, information on why it's important to wear masks and why we are continuing to enforce and encourage people to wear masks?
So masks are important because it's one of the tools that we have right now that can help to decrease the transmission of the virus. So there've been there's lots of debate on how effective masks are. I have seen some studies where they have reported that it can prevent 86% of your droplets from being expelled out into the environment. But there are also other people who don't feel that masks are that effective. The issue is we know that we have community transmission. We know that, of this virus, we know that you can be asymptomatic, so you can look perfectly fine and still be infectious or contagious. It's believed that it's possible that 20% of the cases, the transmission, so 20% of folks who are passing it on to somebody else may not have symptoms at all. Well, there's no vaccine, there's no treatment. Many people do fine with this virus, 80%. It's a really bad flu, it's a bad cold, but 20% do less than fine, end up in the hospital, possibly on a ventilator for days and days and days, and can pass away from this virus. So when you're looking at that, and you're looking at what we have, even if something is not necessarily 100% effective, maybe there's still a debate about its effectiveness. It's something we can do. It's relatively safe. You know, we don't recommend it for those who are less than 2 years old, or if you have some lung issues, or if you put it on and you notice that it's giving you some really, you know, a hard time breathing, then we recommend that you don't wear it. We recommend, though, that if you are within 6 feet of someone, so you can't physically distance, you can't do all those other things that have been shown to be effective. So the hand washing, the physical distancing, the disinfecting high-touch surfaces, the staying home, not being around people who are sick, those things have been shown to be effective. The masking, the facial covering is just one more thing. If maybe you can't do some of those other things, so you're out in public, you're at the grocery store, and you can't keep that physical distance, knowing what the consequences could be, we're just trying to recommend everything that could be helpful. So I feel like it's, you know, it's something that we could do, so it's something that we should do if you're able to do it.
Great. Thank you very much, Dr. Davis. And the last question relative to physicians is really more along the lines of when are doctors' offices going to start opening up to see patients? We talked about that last time you were here. Could you elaborate a little bit about that with some of your conversations with your colleagues?
So my understanding of how things are working out in the community, anybody can start to see patients for preventive and non-urgent medical care and dental care. It's recommended that you kind of look at your situation as a healthcare provider or a healthcare clinician and make sure that you have enough PPE for your staff and yourself to stay safe, and that you put plans in place to keep the people who are using your services, your patients and clients, safe as well. So whether that's physical barriers such as plexiglass, whether it's changing the way that you do appointments to whether, you know, to where you might stay in your car until your appointment is ready, whether it's making sure that your staff has access to testing readily available, and making sure that they know to stay home when they're sick, doing symptom screens. So there's a whole variety of things that healthcare clinicians should be putting in place. And once they're able to do that and have all of that kind of situated, then they are able to continue to practice. And every clinician is kind of have to make that determination for themselves if they feel like they're ready and how they want to go forward.
Thank you, Dr. Davis. All right, as we wrap up this, there's a couple points that I really want to answer on some of the feedback that we're getting. There was a question relative to our testing, and I want to make sure all the listeners and viewers out there understand very clearly, to date, a total of 15,566 specimens have been collected through our testing sites here within the city, which is fantastic as it relates to our capacity to continue to promote testing. And in addition to that, Mayor, will you go a little bit into the parking enforcement? That's obviously a concern a lot of people are having today relative to parking enforcement starting today and some of the concerns with that.
Sure. Obviously, parking's, the city has not done any sort of parking enforcement citations for the last maybe 6 weeks or so, 6-7 weeks. And so enforcement has started today. There are some major health water codes, water cleanliness issues, storm drain issues that need to be addressed citywide. And so we need folks to just please move their cars so that we can clean the streets because some of the streets and some of the neighborhoods are getting really, really bad. And particularly from a water quality perspective, sewers and gutters need to maintain clean for safety. So we have still over 2,500 parking spots that are free to everyone across the city. So if you go to the longbeach.gov site, get free parking at one of these lots and to put cars into. So thank you. And with that, we'll go ahead and do the Spanish translation.
Muchas gracias, alcalde García y doctora Davis. Buenas tardes a todos y gracias por estar con nosotros esta tarde, lunes 18 de mayo. Quiero comenzar, como siempre, con nuestros últimos números. Ahora tenemos 1,305 residentes que dieron positivo del coronavirus. 848 de esas personas ya se han recuperado. Estamos viendo un aumento en los nuevos casos esta semana. Gran parte de eso se atribuye a los atrasos del laboratorio debido al aumento y la capacidad de nuestras pruebas del coronavirus. Desde entonces, también, desde nuestra última información, el viernes hemos perdido a otro residente de Long Beach. Eso eleva el total de muertes en Long Beach al 52. 41 de esos casos se han asociado con centros de enfermería y atención a largo plazo. También hemos visto en los hospitales, desde hoy tenemos 63 pacientes que están hospitalizados. Hace unas pocas horas también el gobernador hubo unos datos sobre el estado de California y sabemos que ha habido flexibilidad en algunos de los plazos que se han impuesto en todo el estado de California, pero desafortunadamente el condado de Los Ángeles y la ciudad de Long Beach no podemos cumplir unos requisitos para poder abrir más flexiblemente. Tenemos que todavía tomar nuestro tiempo y asegurarnos que primero estemos más seguros para abrir y para no tener que regresar a cerrar las opciones que hemos abierto en este momento. También queremos decirles y agradecerles a todos por continuar cooperando con nuestros programas. Sabemos que hay preguntas sobre las calles y el estacionamiento. Todavía hay disponible varios estacionamientos gratis. Nomás tiene que pedir un permiso para estacionar su carro porque es muy importante que los barridos de calle empiecen y ya desde hoy, el 18 de mayo, hemos empezado a dar las fianzas si no mueve su carro. Es muy importante que limpiemos las calles de la ciudad de Long Beach. Mañana por la noche se va a reunir la alcaldía, el consejo, y vamos a considerar unas iniciativas para abrir más espacios públicos para actividades al aire libre y acceso del tránsito y de actividad económica con distancia física segura. Los restaurantes en particular tendrán dificultades para llegar al fin de mes mientras cumplen con los requisitos de distanciamiento físico. Si bien los comedores o restaurantes aún no pueden abrir por órdenes de salud estatales y locales, estamos trabajando arduamente en un plan para reabrir restaurantes de manera más segura. Esperamos expandir la comida al aire libre en espacios abiertos, estacionamientos, calles y aceras. Quiero agradecer a todos los dueños de negocios que han hablado con nosotros por sus aportes, su paciencia y su inversión en Long Beach. Ustedes brindan valiosos servicios a nuestra comunidad. Estamos comprometidos a brindarles ayuda, apoyo para poder continuar haciéndolo. También algunas otras cosas que vamos a tocar mañana en nuestra reunión de la alcaldía es un artículo para extender la moratoria de desalojo que ahorita está al 31 de mayo, pero la queremos extender al 31 de agosto, pero más detalles sobre eso tal vez como al final de esta semana. Es muy importante que sepan, al mismo tiempo que residentes están teniendo problemas en pagar su renta, también los dueños de los edificios, de las casas donde rentan, también están teniendo problemas pagando los plazos de la mensualidad de los hogares que son dueños. Es muy importante entender que no nomás son los residentes que pagan la renta que están sufriendo en este momento. So, estamos viendo cómo podemos ayudar a las personas también. Y como dije, más información sobre eso el miércoles o jueves. También queremos practicar un poco sobre grandes platos entregados. Uno de los problemas que hemos visto y que se ha visto más crítico es que estamos enfrentando desde el comienzo de esta emergencia son los desafíos únicos que enfrentan muchos de nuestros residentes de la tercera edad. Algunas personas han tenido dificultades para obtener lo esencial como las comidas. Hay un nuevo programa que se llama Great Plates Delivered y proporcionará hasta 3 comidas nutritivas gratuitas entregadas diariamente a adultos de mayor edad. Recomiendo que los restauradores y proveedores de alimentos de Long Beach interesados en participar en este programa que completen el proceso de solicitud de propuesta. Hay más información y el periodo de solicitud es de hoy, se abrió el 18 de mayo y cerrará el jueves 21 de mayo a las 11 de la mañana. Puede también enviar sus preguntas sobre este programa a un correo electrónico a greatplateslb@longbeach.gov. Se dará preferencia de participación a las empresas que son de propiedad local y de origen local, priorizar trabajos locales y retención de trabajadores, proporcionar comidas que cumplan con los estándares nutricionales y otras pautas de manejo seguro de alimentos. El nuevo programa comenzará el 29 de mayo y atenderá a los residentes calificados de Long Beach de 65 años o más, junto con los adultos de 60 o 64 años también, porque corren un alto riesgo del coronavirus. Se proporcionará más información sobre cómo los residentes pueden solicitar y recibir estas comidas. Ahora también queremos hablar poco de las condiciones de la salud subsiguientes. Mientras que las empresas y las áreas del aire libre están comenzando a reabrir, esto se debe a que ahora tenemos el conocimiento y los recursos que necesitamos para hacerlo de manera más segura, no porque el riesgo de infección por coronavirus sea menor. Por esta razón es más importante que nunca que las Es más importante que nunca que las personas con mayor riesgo de enfermedades graves tomen medidas para reducir sus posibilidades de infección. Las personas con mayor riesgo de enfermedad grave del coronavirus incluyen personas de 65 años o más y personas que son residentes de los centros de enfermería a largo plazo, y personas de cualquier edad que tienen afecciones médicas subsiguientes graves que incluyen enfermedades como el asma, enfermedad renal crónica o tratamiento con diálisis, enfermedad en los pulmones crónica, el diabetes, trastornos de hemoglobina, personas con su sistema inmunológico comprometido, enfermedades del hígado, afecciones cardíacas graves o si ha sufrido de algún problema de su corazón, y la obesidad severa. Si tiene un mayor riesgo de enfermedad grave por el coronavirus, es muy importante que tome medidas para reducir su riesgo de enfermarse con este virus. Manténgase más seguro en casa, es lo más importante. Evite salir a algunos viajes de crucero o los viajes aéreos que no sean esenciales. Lávese las manos con frecuencia también, más de 20 segundos. Practique el distanciamiento físico, evite las áreas públicas abarrotadas y manténganse por lo menos 6 pies de distancia de cualquier persona con la que no vive. También es muy importante que sigamos las sugerencias que ha dado el Departamento de Salud en usar las cubiertas faciales. Sabemos que a algunas personas no les gusta o no creen que es una área de protección contra el virus, pero es nomás algo adicional para proteger a las otras personas, porque recuerden que pueden tener el virus en su cuerpo, no necesariamente experimenta síntomas, pero también todavía puede contagiar a otras personas. Por favor, manténganse alejados de las personas que están enfermas. Si no tiene que salir de su casa, por favor, no salgan. Limpie y desinfecte las superficies frecuentemente y todos los lugares de su hogar. Además, si tiene problemas de salud, maneje su condición lo mejor que pueda continúe sus medicamentos, no cambie su plan de tratamiento sin hablar con su médico primero. Sabemos que también en estos próximos días veremos que los médicos van a reabrir sus centros médicos. Todavía en este momento están viendo a personas con emergencias, pero es muy importante que use por teléfono o por video telehealth, haga sus citas con sus médicos para poder planear mejor sus medicamentos, tratamientos, y también es muy importante tratar la manera de agarrar sus medicamentos por lo menos como de 90 días para que tenga suficientes medicamentos en su hogar. Hable por otra vez, si necesita o es un caso de una emergencia, llame al 911 o siga las atenciones médicas que le recomiendan. Esto es todo por hoy. Muchas gracias por estar con nosotros esta tarde.
Y muchas gracias también, and just thank everybody for watching, and we'll see everybody Wednesday at 3 o'clock. We hope to have more information then. Stay safe.